Question 1. A nurse on a postpartum unit is delegating tasks. Which is the most appropriate assignment? A. Assign a newly licensed RN to assess a stable postpartum client 6 hours after delivery. B. Assign an LPN to administer 4-oxytocin to a client with postpartum hemorrhage. C. Delegate the assessment of lochia in a postpartum client to a UAP. D. Assign a UAP to educate a new mother on breastfeeding techniques. Answer. A. Assign a newly licensed RN to assess a stable postpartum client 6 hours after delivery. Question 2. Which postpartum client requires immediate attention? A. A client who reports perineal discomfort while sitting. B. A client with a saturated peri-pad in 15 minutes. C. A client requesting assistance with breastfeeding. D. A client experiencing after pains. Answer. B. A client with a saturated peri-pad in 15 minutes. Question 3. Which task can be safely delegated to a UAP in a labor and delivery unit? A. Monitor fetal heart tones. B. Assist the client with ambulation to the bathroom. C. Perform a vaginal exam. D. Evaluate contraction patterns. Answer. B. Assist the client with ambulation to the bathroom. Question 4. A nurse receives 4 calls from postpartum clients. Which one should the nurse return first? A. Reports constipation and abdominal bloating. B. Has a temperature of 100.6 degrees Fahrenheit and mild breast tenderness. C. Reports calf pain and swelling in one leg. D. Has questions about resuming sexual activity. Answer. C. Reports calf pain and swelling in one leg. Question 5. The nurse is caring for a client in labor who is receiving oxytocin. Which finding requires immediate intervention? A. Contractions occurring every 5 minutes, lasting 60 seconds. B. The fetal heart rate baseline is 140 BPM. C. The uterus is soft between contractions. D. Contractions are every 90 seconds, lasting 90 seconds. Answer. D. Contractions are every 90 seconds, lasting 90 seconds. Question 6. Which action by the nurse best demonstrates patient safety during a magnesium sulfate infusion? A. Monitor deep tendon reflexes and respiratory rate every 4 hours. B. Encourage fluid intake of 3 liters per day. C. Administer the drug rapidly via 4-push. D. Place the client in a Trendelenburg position. Answer. A. Monitor deep tendon reflexes and respiratory rate every 4 hours. Question 7. Which task is inappropriate for a UAP caring for a postpartum client? A. Checking vital signs. B. Assisting with perineal hygiene. C. Documenting the amount of lochia. D. Helping the client change pads. Answer. C. Documenting the amount of lochia. Question 8. A nurse is caring for a client with preeclampsia. Which assessment should the nurse prioritize? A. Assessing the uterine fundus. B. Monitoring ankle reflexes. C. Measuring urine ketones. D. Checking for clonus and blood pressure. Answer. D. Checking for clonus and blood pressure. Question 9. Which postpartum client should the nurse assess first? A. A woman 6 hours post-cesarean with a PCA pump. B. A woman with heavy lochia and dizziness. C. A woman requesting pain medication for perineal discomfort. D. A woman who has not urinated for 4 hours. Answer. B. A woman with heavy lochia and dizziness. Question 10. The nurse is reviewing newborn care teaching. Which instruction is a priority for patient safety? A. Bathe the baby once daily. B. Place baby on the stomach to prevent choking. C. Always put the baby to sleep on their back. D. Avoid breastfeeding during the first 24 hours. Answer. C. Always put the baby to sleep on their back. Question 11. A client in labor is receiving epidural anesthesia. What is the nurse's priority action? A. Monitor maternal oxygen saturation every 6 hours. B. Assess maternal blood pressure every 5 to 15 minutes. C. Encourage ambulation to promote labor. D. Position the client flat on her back. Answer. B. Assess maternal blood pressure every 5 to 15 minutes. Question 12. Which situation requires the nurse to notify the provider immediately in a pregnant client? A. Mild swelling of the ankles in the evening. B. Headache not relieved by acetaminophen. C. Occasional Braxton Hicks contractions. D. Back pain after walking. Answer. B. Headache not relieved by acetaminophen. Question 13. A nurse is assigning care. Which client should be assigned to an LPN? A. Client with eclampsia requiring seizure precautions. B. Client in active labor with late decelerations. C. Client 2 days postpartum needing perineal care. D. Client with a prolapsed cord. Answer. C. Client 2 days postpartum needing perineal care. Question 14. A postpartum client is at risk for hemorrhage. Which order should the nurse question? A. Oxytocin 10 units IM. B. Fundal massage every 15 minutes. C. For fluids at 200 milliliters per hour. D. Morphine 10 milligrams for every hour. Answer. D. Morphine 10 milligrams for every hour. Question 15. What is the most appropriate action after noting early decelerations on the fetal monitor? A. Prepare for emergency C-section. B. Reposition the mother to her left side. C. Continue to monitor. No immediate action needed. D. Administer oxygen at 10 liters per minute. Answer. C. Continue to monitor. No immediate action needed. Question 16. Which postpartum instruction should be emphasized to prevent complications? A. Resume exercise as soon as possible. B. Avoid iron-rich foods. C. Call if lochia becomes bright red and heavy. D. Apply ice to breasts for engorgement. Answer. C. Call if lochia becomes bright red and heavy. Question 17. A client in the 3rd trimester reports itching palms and soles. What is the nurse's best response? A. Recommend lotion for comfort. B. Reassure that it's normal in pregnancy. C. Notify the provider immediately. D. Encourage warm baths. Answer. C. Notify the provider immediately. Question 18. Which instruction is safest when caring for a pregnant client with a history of domestic abuse? A. Document only physical injuries. B. Notify law enforcement immediately. C. Interview the client privately and offer resources. D. Avoid addressing the topic unless the client brings it up. Answer. C. Interview the client privately and offer resources. Question 19. The nurse is assessing a 2-hour postpartum client. Which finding requires immediate intervention? A. Fundus firm and midline. B. Pad saturated in 15 minutes. C. Moderate lochia rubra. D. Mild uterine cramping. Answer. B. Pad saturated in 15 minutes. Question 20. A laboring client's membranes rupture. What is the nurse's priority? A. Check maternal temperature. B. Perform a vaginal examination. C. Assess fetal heart rate. D. Prepare for delivery. Answer. C. Assess fetal heart rate. Question 21. A nurse is caring for a client with a history of placenta previa. Which action is a priority? A. Monitor for signs of infection. B. Assess for painless vaginal bleeding. C. Palpate the uterus for contractions. D. Encourage early ambulation. Answer. B. Assess for painless vaginal bleeding. Question 22. Which task should the nurse assign to the LPN on the labor unit? A. Interpret fetal heart monitor strips. B. Monitor for oxytocin infusion during induction. C. Administer oral pain medications to a stable client. D. Develop a care plan for a high-risk pregnancy. Answer. C. Administer oral pain medications to a stable client. Question 23. A nurse notes a boggy uterus in a postpartum client. What is the first nursing action? A. Notify the healthcare provider. B. Start a second four-line. C. Massage the fundus firmly. D. Insert a Foley catheter. Answer. C. Massage the fundus firmly. Question 24. A nurse observes variable decelerations on the fetal monitor. What is the priority action? A. Administer oxygen via face mask. B. Reposition the client. C. Discontinue oxytocin. D. Prepare for cesarean delivery. Answer. B. Reposition the client. Question 25. The nurse is planning care for a client with severe preeclampsia. Which task should be delegated to a UAP? A. Monitor deep tendon reflexes. B. Measure urine protein level. C. Assist with hygiene needs. D. Assess for visual disturbances. Answer. C. Assist with hygiene needs. Question 26. A client is in the third stage of labor. Which assessment is most critical at this time? A. Maternal temperature. B. Fetal heart rate. C. Fundal firmness and bleeding. D. Bladder fullness. Answer. C. Fundal firmness and bleeding. Question 27. A nurse is caring for a client receiving magnesium sulfate. Which finding requires immediate intervention? A. Absent deep tendon reflexes. B. Fetal heart rate of 140 bpm. C. Mild nausea. D. Urine output of 40 milliliters per hour. Answer. A. Absent deep tendon reflexes. Question 28. Which statement by a pregnant client requires further education? A. I will lie on my left side to improve circulation. B. I will take my prenatal vitamins daily. C. I will avoid lunch meats unless heated. D. I can continue taking ibuprofen for headaches. Answer. D. I can continue taking ibuprofen for headaches. Question 29. A laboring client suddenly complains of chest pain and shortness of breath. What is the priority nursing action? A. Apply oxygen and call the provider. B. Check the cervix for dilation. C. Prepare for epidural anesthesia. D. Place the client in Trendelenburg position. Answer. A. Apply oxygen and call the provider. Question 30. A nurse is preparing to assign tasks. Which client should the RN care for directly? A. Stable client 2 hours post-vaginal delivery. B. Client with suspected uterine rupture. C. Client needing perineal care. D. Client ready for newborn discharge teaching. Answer. B. Client with suspected uterine rupture. Question 31. A nurse is caring for a pregnant adolescent. Which action demonstrates advocacy? A. Teach about safe sex practices. B. Offer prenatal vitamins. C. Provide privacy and involve the client in decisions. D. Discuss pregnancy outcomes with parents only. Answer. C. Provide privacy and involve the client in decisions. Question 32. What is the priority nursing action during a postpartum hemorrhage? A. Call the rapid response team. B. Administer pain medication. C. Assess uterine tone and massage if needed. D. Insert an indwelling catheter. Answer. C. Assess uterine tone and massage if needed. Question 33. A newborn is placed under a radiant warmer. What assessment is most important? A. Skin turgor. B. Axillary temperature. C. Respiratory rate. D. APGAR score. Answer: B. Axillary temperature. Question 34. A postpartum client expresses fear about caring for her newborn. What is the nurse's best response? A. Don't worry, it gets easier. B. You just need practice. C. Let's talk about what you're feeling and how we can help. D. Your partner can help too. Answer: C. Let's talk about what you're feeling and how we can help. Question 35. A nurse is assessing a pregnant client with gestational diabetes. Which finding is concerning? A. Blood glucose of 88 milligrams per deciliter. B. Fundal height appropriate for gestation. C. Headache and visual changes. D. Mild lower back pain. Answer: C. Headache and visual changes. Question 36. A nurse floats to the maternity unit. Which assignment is most appropriate? A. Unstable preeclampsia client on magnesium sulfate. B. Laboring client with fetal distress. C. Postpartum client needing discharge teaching. D. Client with shoulder dystocia during delivery. Answer: C. Postpartum client needing discharge teaching. Question 37. A nurse is caring for a postpartum client with a history of bipolar disorder. What is most important? A. Provide dietary counseling. B. Monitor for signs of postpartum psychosis. C. Educate about newborn immunizations. D. Discuss breastfeeding positions. Answer: B. Monitor for signs of postpartum psychosis. Question 38. A nurse is teaching a prenatal class. Which topic has the highest priority for third trimester clients? A. Bottle feeding techniques. B. When to go to the hospital for labor. C. Diapering and bathing the baby. D. Postpartum exercise routines. Answer: B. When to go to the hospital for labor. Question 39. Which action by the nurse promotes newborn safety immediately after delivery? A. Administering vitamin K. B. Placing the newborn on the mother's abdomen. C. Suctioning the nose and mouth. D. Placing an ID band on the infant. Answer: D. Placing an ID band on the infant. Question 40. A nurse notes bright red bleeding in a client 24 hours postpartum with a firm fundus. What is the likely cause? A. Uterine atony. B. Perineal laceration. C. Retained placenta. D. Endometritis. Answer: B. Perineal laceration. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.